Okay.
The apex of the heart with the left ventricle, right ventricle, coronary artery visible. The auricle of the right atrium. The right atrium is back here. I split the heart from apex towards the base, getting through 3 chambers, the left ventricle, the right ventricle, and the right atrium, to which is attached, the right atrium to which is attached the inferior vena cava coming from the liver through the diaphragm, and the superior vena cava coming from the head and arm region, and that's the major drainages. On this side we can also see the auricle of the left atrium and the left atrium in the back side collecting the blood from the lungs. All right. Then on the superficial vessels coming from the anterior region, the head region, superior vena cava, and if we move the heart and lungs to the animal's left, we can see a major drainage of the chest region known as the azygos, and we can see several branches from the upper ribs, that's the azygos, and then we move up the superior vena cava and we find a tributary coming in off of the right side. This tributary is the right vertebral vein. Then, as we follow the superior vena cava to its origins, it's formed primarily by 2 vessels, the right brachiocephalic and the left brachiocephalic. Each brachiocephalic is formed by an external jugular and a subclavian. You can find them on both sides. And there is a 3rd vessel, but usually is not injected in most of the... Oh, there it is. That's not it. There is a 3rd vessel that forms the brachiocephalic called the internal jugular. It's not on this particular cat. Nope. All right. As we move out onto the arm, the subclavian becomes the axillary, and the axillary has 2 major branches. The first one is the ventral thoracic. This is the ventral thoracic vein. Right next to it is the ventral thoracic artery from the arterial system, which we'll point out a little bit later. But that's the ventral thoracic vein right there. And then we have the long thoracic, which is next. That's this vessel, and there should be an artery paralleling that. There is, off of the axillary artery. And then we get out onto the arm and we have the brachial vein. And we're going to switch to that side for the brachial vein because it's better. And the brachial vein has a branch that goes around the outside of the, called the circumflex, but we won't spend much time with that. If we go back now to the brachial vein, the brachial vein, as it approaches the axillary portion and becomes a subclavian, has a branch from that's the scapular vein coming into the brachial to form the subclavian. And there we go. Now I'm exposing the subclavian artery, and the subclavian artery gives rise to the ventral thoracic, and the long thoracic, which is that piece there, goes down onto the scapula. The long thoracic is better seen on the other side. There's your long thoracic vein and your long thoracic artery right next to it, off of the axillary artery. And now